Hello, my name is Dr. Doeun Lee. I am a board-certified endocrinologist with 25 years of experience. So first topic I chose to talk about on my YouTube channel is Hashimoto thyroiditis. A lot of patients are curious about Hashimoto thyroiditis as to why they get it, how to get rid of it, how to treat it, how to manage it, what this is really all about. So I am here to talk about pathophysiology, how to make the diagnosis, and what is really the best treatment course. Sorry for the glare of this, on the whiteboard. I'm not an expert videographer. This is my first time doing this, and so apologize for the glare. So I do want to talk about this guy called Hashimoto thyroiditis. There are about 7 to 8% of general population that have Hashimoto thyroiditis. So I would say prevalence is really, really high. And we diagnose patients with Hashimoto thyroiditis all the time. And patients have a lot of questions: diet, exercise, how to manage this. So Hashimoto thyroiditis is basically autoimmune thyroid disorder. You didn't really do anything to get this. Just for the record, I also have Hashimoto thyroiditis, which was diagnosed during my endocrinology fellowship, which was quite interesting. And so I will have to share my story about how we made a diagnosis of Hashimoto thyroiditis in my case. But basically, your immune system is recognizing your thyroid gland, even though it is your own, to be foreign. And so your immune system is trying to remove your thyroid gland from your system. So what happens is your lymphatic system, immune system, is making lots of, mobilizing a lot of lymphocytes into the thyroid tissue. Lymphocytes really should not be in the thyroid gland, but Hashimoto patients will have lymphocytes in the thyroid gland when we do the biopsy. So Hashimoto thyroiditis, also pathological name is, by pathology, would be chronic lymphocytic thyroiditis. Meaning it's chronically lymphocytic infiltration causing inflammation in the thyroid gland. Itis meaning inflammation. So instead of having healthy thyroid tissue, you've got lymphocytes into the thyroid gland. So your thyroid function is potentially diminished. Doesn't need to be always, but a lot of times it is. We do have a lot of patients with Hashimoto thyroiditis going through life without any thyroid disorder, I mean functional disorder, whereas some people do develop full-blown hypothyroidism early in their life. Sometimes they present with hyperthyroidism and then flip over to hypothyroidism. Sometimes they present with hypothyroidism, sometimes they flip to hyperthyroidism. So various courses can be had if you do have Hashimoto thyroiditis. Most commonly, we do have patients with hypothyroidism manifested by a lot of symptoms of hypothyroidism, but also hallmarker for Hashimoto thyroiditis is antibody, but also often TSH elevation. So we do get questions about how to manage this. If you do have hypothyroidism caused by Hashimoto thyroiditis, we do recommend thyroid hormone replacement if you're symptomatic, just because your thyroid is unable to make your thyroid hormone that is, keeping you alive, basically. So if you're low on thyroid and you have symptoms and you go on thyroid hormone replacement, likely your symptoms will be improving. Some folks do like to address this disorder by a diet. So about that, I do hear patients get advised on gluten-free diet or other diet. Like, a lot of books written by a naturopath or nutrition scientist. Talk about Hashimoto thyroiditis, root cause, how to get rid of Hashimoto by diet. So the data are extremely limited, and we don't really have a ton of evidence. I have to say, if you are on an extreme diet, such as autoimmune protocol diet, I often tell the patients that I cannot be remaining on autoimmune protocol diet more than probably 3 hours because it's really limiting. You basically have almost nothing to eat. In my opinion, I'm sure there are people who disagree with me. Even then, when you do go on autoimmune protocol diet, what happens is you're not really getting rid of it. You do diminish the intensity of the disease. So if you did feel horrible on a horrible diet, and then you go on an autoimmune protocol diet, just because you were not really eating processed food, you're you're on much healthier diet. Most likely your symptoms are going to be better. Because I'm a huge believer in healthy diet. Diet really is causing you to have a lot of symptoms. Of course, other conditions affected, but diet is, I would say, huge part of your health. So if you get rid of inflammation causing products from your diet, such as processed food. I am really a proponent of unprocessed food, if possible. In my household, I do not carry processed items. I really do recommend not consuming processed meat. That would include chums, beef steak, sausages, already made meatballs, prosciutto, salami, smoked this or that. Those things will be considered processed meat. If you do get rid of those, processed food from your diet, of course you're going to feel better. So what the clinical trials have shown in autoimmune protocol diet is that you do diminish antibody titer, and you do often you're able to decrease the dosage of thyroid hormone. However, we haven't seen a case where you are able to completely get rid of it. Anecdotally, I'm sure you will have someone who was a very, very mild spectrum of the disease, who was requiring very small dosage of thyroid hormone and go on a autoimmune protocol diet and then go off of thyroid hormone. I think that's possible because your disease wasn't really very severe to begin with. So that's what I really wanted to tell you. You don't really need to go on a very severely restricting diet in order to get rid of Hashimoto thyroiditis, because you can't. You can reduce antibody titer, but really you're not going to get rid of antibody titer. But also your thyroid hormone replacement dosage is going to go down a little, but you're really not able to get off of it. Because a lot of times when you go off of it, you're going to need to go back on thyroid hormone because your thyroid levels go down. Gluten-free diet is very much similar. Gluten-free diet is probably less restrictive than autoimmune protocol diet. But gluten-free diet also, if you do go on a gluten-free diet, people start to look at the label and suddenly they realize, that has a lot of calories, it has a lot of preservatives. They tend to get rid of those stuff from their diet. Therefore, they tend to eat healthier. No wonder they feel better. So really, if you do feel better on gluten-free diet, please do continue to go on a gluten-free diet. But if you don't really have any celiac disease and you are generally eating really healthy, you don't need to be on gluten-free diet, in my opinion. But if you feel better on gluten-free diet, please continue to stay on gluten-free diet, because that's what makes you feel good. I'm really a firm believer of lifestyle that works for you. So that's basically what I need to tell you about Hashimoto thyroiditis in general and implication of diet in Hashimoto thyroiditis and its effect on antibody levels and thyroid hormone replacement requirement. So in terms of the diagnosis, Diagnosis is made on based on exam, thyroid hormone, thyroid gland examination, physical examination. But also we heavily rely on labs. Endocrinologists love labs. We love labs. So labs would include TPO antibodies. TPO stands for thyroid peroxidase antibody. Often we also get thyroglobulin antibody. And then also we get TSH. Often we do get imaging with ultrasound. About thyroid imaging, nothing better than ultrasound. CT scan, MRI, much more expensive, but for a gland that sits just below skin, ultrasound has the best resolution, best diagnostic, ability. So if you do want to look at your thyroid, don't go for MRI, don't go for CT scan, you want to do the ultrasound. Thyroid peroxidase antibody often are elevated. Not always, but almost always are elevated. And then thyroglobulin antibody, which is less specific, almost always elevated as well. And thyroid gland stimulating hormone can be normal, or low, or high. So any TSH can be had if you do have Hashimoto thyroiditis. I did tell you in the beginning of the talk, I was going to discuss my case of thyroid diagnosis. So I do have the diagnosis of Hashimoto thyroiditis, and that was diagnosed by my endocrine fellowship director, Dr. Larry Shapiro, who is now retired. Love the guy. Thank you. So he, maybe about a year into fellowship program, he said, Dr. Lee, you have a thyroid condition. And I said, well, I don't think so. I don't have any symptoms. My hair is fine. My skin is fine. I don't have any constipation. I am full of energy. I just have a little bit of dry eyes and I shouldn't really have Hashimoto. And he goes, yeah, we'll check. And so, okay, yeah, we'll check. About a month later, we had a thyroid ultrasound didactic. So you do everybody else's ultrasound, among your colleagues. So we scanned my friend Cindy. We scanned my friend, other people in the fellowship program. And when they scanned my neck, it was a slam dunk Hashimoto thyroiditis. Maybe I will link another video that shows normal gland versus Hashimoto thyroiditis gland. In typical case, some Hashimoto glands can be looking normal, especially in the beginning of the disease state. But often you will have ultrasound feature that shows significant inflammation on ultrasound. What I mean by that is, it's like an easy way to think about is you pour over the sugar on the kitchen countertop, versus you pour over oatmeal on a countertop. So you see the sugar is very soft and even keel texture, whereas oatmeal is more irregular. So normal gland is sugar and my gland is oatmeal. So it was extremely irregular, bunch of holes. It's like also we call it giraffe pattern. All this bunch of holes, meaning like dark spots on the ultrasound, is there because of aggregated lymphocytic infiltration in the thyroid gland. So when you biopsy, you will see lymphocytic infiltration on the biopsy, and that's shown on the ultrasound as a dark spot. So I did really have ugly thyroid gland, and so we had no doubt. At that point, I had Hashimoto thyroiditis, and we went for an antibody testing to confirm, and voila, I was negative. And so that really contradicted to textbook Hashimoto thyroiditis diagnosis, because most textbook will tell you TPO antibody negative, you don't have Hashimoto. But I was seronegative. I mean, also the textbook will tell you there is about like 5% of patients that do not have antibody. We call that seronegative disease. So I was seronegative Hashimoto, basically. So my TPO antibody, TG antibody were negative, but then ultrasound was very positive, and my TSH was running a little high. So that confirmed I had Hashimoto thyroiditis based on ultrasound features, not based on antibody status. TSH really not based on TSH level, because TSH of 3.5 is considered normal. So I wouldn't say we made a diagnosis by any of the blood tests, but we did make a diagnosis by physical exam. Dr. Larry Shapiro, such a great thyroid diagnostician, he just routed right away, just by looking at me, he knew I had Hashimoto thyroiditis, which was really mind-boggling at the time. And we did confirm it by ultrasound, because no normal gland should look like what I had. So knowing I had Hashimoto thyroiditis, going into pregnancy 14 years ago, I knew I had to be on thyroid hormone, because Hashimoto patients usually are short on supply when increased in demand, which is basically during pregnancy, you do have increase in demand of your thyroid hormone. And thyroid patients, Hashimoto thyroiditis patients, are simply unable to keep up with the demand for the most part. So it is better to be on thyroid medication in preparation for pregnancy, so that you go into trimester well prepared. So that is basically all I have to say for now about pathophysiology, implication of the diet, and how we make the diagnosis. So actually before I close off, the diagnosis is based on all kinds of combinations. So in order to make the proper diagnosis, you really need to see a specialist. If you have a slam dunk disease, let's say your thyroid is ugly, TPO antibody is high, TSH is high or normal, but TPO antibody is high and ultrasound is positive, I mean, it's really no-brainer. You've got Hashimoto thyroiditis. But if something is not fitting together, there's a little bit of head scratcher going on, then you probably do need to see a specialist in order to make the firm diagnosis. So that is my advice, and that's how we make the diagnosis. And if you do have any further questions, please comment below so I can answer individually. So thanks for listening, and I will hope to see you in the next video, where I will talk about management of hypothyroidism.